Hi, everyone who's joining us. I'm seeing the number of participants go up, so we're just going to wait a minute to let everyone join, and then we'll get started. But thanks for being here. Okay, slowing down, so we will get started. Well, thank you all for being here. Welcome. I'm Assemblymember Rebecca Bauer-Kahan, and I want to thank you so much for joining us for our virtual town hall today to talk about the COVID-19 vaccines for kids and teens. So this is a topic that is obviously near and dear to my heart as a mom of 3 kids who, although all my kids are under 12, so not yet eligible to be vaccinated, but I know firsthand what it means to be a parent and make these important decisions for our children. So we wanted to get us all together today for this super important conversation about what it means to get our kids vaccinated and answer all the questions that you may have. Although, to be fair, we may not get to all of your questions. We will do our best, but feel free if you do have questions to use the Q&A function and pop them in there, and we will get to as many of them as we can. Before we get started, I want to just thank all of you, our community who are joining us, for the sacrifices that you have made over the last 15 months. I know many of you are either youth yourself or parents, and this has been an incredibly hard year for our kids and for our families, being out of the classroom for many months, not being able to be with their friends in the ways that they so cherish. And that work that we did, keeping social distance and wearing our masks, has really gotten us to the place we are today. So thank you for your partnership in that. I am so grateful that we are where we are with vaccinations and with the number of people in our community who are protected at this point. And we just want to continue to make sure that we are working towards ensuring that everyone is protected from this virus that has taken too many lives in our community and our country. So I also, of course, want to thank our public and private healthcare providers, some of whom are here today with us, and all the other essential workers who have gotten us to this point. I don't know how many of you like to listen to the Daily from the New York Times, but they did an incredible piece last week on the scientists who invented the mRNA technology that is a huge part of the vaccine technology that we have today. And it gave me so much gratitude for all of the scientists and healthcare providers who have ensured that we are as safe as we are today. And we are so lucky to be where we are and blessed. So I just want to acknowledge that. I also want to say that my staff and I are here to support you in any way. You will hear me be really quiet soon because I'm not the expert. You're going to be hearing from the experts, but we are here to help connect you with the best information, make sure you know where you can get these vaccines if you need information, or if you have any help you need from state agencies. And so my staff is going to put our contact information in the chat, and we can post any relevant links throughout the conversation as well. So let's get to our conversation about the important topic that we're here to talk about. And I want to first introduce our guests. So first, we have Dr. Donnell Moody, Chief Medical Officer of Access Community Health. And I'm so excited to have her here today for a couple of reasons. One is Access Community Health is the Assembly District 16 Nonprofit of the Year. We are so grateful for the incredible work that Access has done in reaching out to our hard to reach communities, ensuring that they were cared for during the height of this pandemic, ensuring they got ongoing care for their conditions that weren't related to the virus during times when access to healthcare was challenging, and then stepping up and doing incredible work testing and vaccinating the community. So thank you, Dr. Moody, for your leadership on that. We're really excited to have you here. Joining us is Professor of Public Health, John Schwartzberg, who will talk to us about vaccines and how they were studied and give us more information if we have questions on that. We have Dr. Robin Mizan from John Muir Health, who is Dr. Moody and Dr. Mizan are both pediatricians in our community who are here to help address questions related to the health of our youth and the vaccine efficacy. And last, but definitely not least, we are so excited to have Katie Chen, a youth advocate from Generation Up. And, all of these people are incredible leaders in our community and experts in this topic. So I'm really excited to have them here for this conversation. But let's start with Dr. Moody. First of all, I want to just again thank you for your incredible work. It's been amazing to be in partnership with our health providers and watch the lengths that all of you have gone to protect our community, and I'm so grateful for that. But can you just tell us a little bit about what Access is doing in Alameda County? Access, for those that don't know, is a huge provider of medical care for those in the Tri-Valley. So what are you doing to reach our hard to reach communities when it comes to vaccination and the vaccine efforts?
Yeah, so thank you for that introduction, Assembly Member. And Access has been around nearly 50 years, taking care of everyone in the community who wouldn't otherwise have access to healthcare. So uninsured, underinsured, anyone on Medi-Cal. We've always been there, but since the pandemic started, we've been doing outreach to our highest risk patients, made sure they had enough medications, made sure they still had access to their providers. Starting in summer of last year, we started providing COVID testing to all of the community free of charge. And that's still ongoing to that day. And we plan to continue offering testing to everyone. Starting in January, we began vaccinating with the COVID vaccines, starting with our highest risk patients and then trickling out to all of the community. So at this point, we're vaccinating anyone and everyone, but with a focus on those hardest to reach and hardest hit populations. So the people who were hardest hit during the pandemics, including our Latinx and Latino neighbors, Latina neighbors, everyone who's maybe under sheltered or homeless. We've been really trying to get out into those populations. And to date, we've given over 15,000 doses. Our demographics so far show that the work we're doing it's working. The biggest demographic we've vaccinated so far is Latinx, followed by Asian. So we're really proud of the work we're doing and trying to stop the transmission of COVID in our neighborhoods and our community.
Thank you for that. And I know, I don't know the answer to this, but are some of those communities that you're working really hard to get vaccinated, are you seeing reluctance to be vaccinated? And if so, what are you doing to address it?
Yeah, that's a great question. So we are seeing reluctance in some specific occupational groups, maybe some demographics. We've started shifting our strategy to vaccinate, to bring the vaccine to the people. Recently, we started vaccinating at the Livermore Main Library branch, where anyone can walk in and get a vaccine on Tuesdays or Thursdays. We're also doing outreach to different labor organizations, churches, starting a dialogue to address what are some of the reasons people might be hesitant, what questions do they have, trying to address those, and then holding an on-site Q&A session where we'll be able to offer the vaccine then and there for anyone who's ready for it.
That's great. Thank you for that important work. I know, as I said at the beginning, our healthcare providers, especially, Access Community Health, which, as you said, has been around for almost 50 years, is really a trusted source. So it's so critical that you be a partner in the community doing that work. So thank you. Do you know where we are in Alameda County in terms of vaccinating our 12 to 18-year-olds?
Yeah, so according to the latest data, yesterday, 56% of our 12 to 15-year-olds in Alameda County have gotten at least one dose of that vaccine. So we've passed that halfway mark for vaccinating with at least one dose. 37% are completely vaccinated. So those are the 12 to 15-year-olds who have gotten 2 doses of Pfizer. Pfizer's the only one approved under 18. So we're really proud of the work that's going on in Alameda County. I think this is great work. We still have a ways to go, but to give you an idea of where the whole population in Alameda County is right now, 79.6% of all residents 12 and up have at least one dose, and 66% are fully vaccinated.
That's amazing. So we've got a ways to go with those young folks, but hopefully we can get there before the start of school. So thank you for your efforts. Dr. Mizan, I have a question for you. As I said, Dr. Mizan's a pediatrician with John Muir Health here in Contra Costa County. And what are you seeing in your practice with vaccinating those kids that are eligible?
A lot of enthusiasm. I will tell you, my kids are exactly this age. They are 12 and 15. So speaking for myself as a mom and for my kids, there was a lot of excitement in our house when my kids were able to get vaccinated. And I'm seeing that really mirrored in my community where people were just like counting down the days and when it was approved, scheduling their appointments and getting their kids vaccinated. And I see as my kids start their summer and all my patients start their summer that things are opened up to them. The sports they want to do, the camps they want to do are now more open, more free, and they're able to participate in them. So I will say in my practice and in my community, I've seen just excitement and appreciation for being able to get their vaccines.
That's so great. As I said, my oldest is not yet 12, so my kids aren't eligible yet. But I have to say that my 7-year-old, we were walking together yesterday, and he said, "Mom, when do I get to get my vaccine? I want to be safe without a mask too." So I hear that. I think our kids, they've lived through this too. So I think there is some excitement on their part aside from us. So I'm looking forward to when my little ones, when we know it's safe for them and they can get vaccinated. And so with families and kids that you're interacting with, are people raising concerns and questions regarding younger people getting vaccinated? And how do you respond to those fears or hesitations?
I don't get a lot of concerns or questions about the vaccine itself. Sometimes what I get is it important for me, given that kids don't get that sick? And usually just having that conversation about um, that we all are citizens in a community, and although it can be serious for children, but we know that as we get our community vaccinated, we can all move forward. And that often is like the super small step of like, oh, of course, then I wanted to do this to help, just to be part of our community. And I think like a lot of things we do as community partners and citizens, and each individually, as we think of ourselves, like, is this good for me? Is it good for my kid? And then is it good for everyone? And this is it's really good for everyone situation, because we really all knit together, and when all of us move forward, we all do well. So I think that's the typical question I get. And then just a question like, just a confirmation that we think the vaccine is good and safe. And of course, I think it's fantastic, and I'm happy to be able to work with my families to get them vaccinated.
That's great. And I know, both of you have patients who, for medical reasons, can't be vaccinated, right? We have community members who aren't eligible and won't be eligible. And so there is a part of this that is about us stepping up as people who are safe to get vaccinated to protect those community members as well.
Yeah.
So I think that is such a critical point. So Dr. Moody, anything to add on what Dr. Mizan was talking about? Do you see?
No, I agree on all points. Although children typically don't get as sick as older people with COVID, there are unfortunately still children who have gotten severe cases, needed hospitalization. There's been about 15,000 kids who have needed to be hospitalized since the pandemic started. So while the risk is minimal, it's still not zero, and it's normal to, have questions and concerns. I'm a mom of a 7 and a 9-year-old, so I completely understand, where I'm coming from. And what are the risks? What are the benefits to my kids? I want to protect them. And when I look at the benefits versus the risks, it's pretty clear that it's a good idea to vaccinate our children as well.
Yeah. No, I have so much respect for the mama bear, right? I mean, that's what each of us do, right? Our job is to protect our children. And I think I trust my pediatrician. I trust the pediatricians in my life that I know to help me understand, what is the best way to protect my children and the children in the community, to Dr. Mizan's point, which is also really critical because we are a community. So now we're open, which is obviously big as of last week, and mask wearing for those of us that are vaccinated is now very different and not required in most settings. How does, given sort of the change in atmosphere, vaccinating our kids play in? Is it more important now that we're reopened to get our kids vaccinated, or is it just the same? I guess I'll put that to Dr. Moody.
Yeah, I think it's more important than ever for us to continue our recovery, our new normal, where we're able to go to the farmer's market in Livermore and see each other without masks, and go to the park at San Ramon. It's important to vaccinate everyone, because the nature of the virus that causes COVID is to mutate, and the more times it's passed around, the more chances it might tweak itself a little bit. And that's where we see some of these variants that have come over. So the Alpha variant, what we know is the UK variant, and now the Delta variant that there's concern about. So the more of the population that's unvaccinated, the more chance there is that something might develop that makes our vaccines maybe less effective, hopefully not. But that's something the CDC and the WHO are certainly going to be watching. But it's important to try to give this virus no safe harbor to rest in, and try to get as much of the population vaccinated. And we know these vaccines work. If you look at the curve of cases, it's pretty astounding where we're at, especially in California.
Yeah, no, that's a really, and I just want to follow up on that. So one of the things for our kids that maybe aren't eligible yet and aren't vaccinated or haven't gotten vaccinated, they can be, even though they don't get that sick, can they be that safe harbor for the virus to mutate and to move on?
There is the potential. So at the beginning of the pandemic, only about 3% of cases were in children under 18, and that might have been a little under testing of kids, but that's the data we have right now. 25% of new cases are children. So we know that it can get passed in kids, and that's why I fully support masking in schools as they reopen in August. That's going to be a big part of our sort of return to normal until there's enough data for us to extend the emergency use authorization down to lower ages. It's still important for kids to take those measures.
Thank you. That was interesting information, and another important reason for us to help by ensuring that we're all getting vaccinated. Professor Schwartzberg, welcome. I'm happy to have you here. And I want to pose actually the same question to you first, which is, at this stage in the pandemic, what impact do you think vaccinations in youth will make?
Well, first of all, let me congratulate Dr. Moody on what she's accomplished. Not just she, her organization has accomplished with getting people vaccinated. It's exactly what we need more of in this country. So I completely agree with the comments that Dr. Moody and Dr. Moody were making before in addressing this. What we're seeing is, if you look at this virus from the perspective of any life form, although you can argue that viruses may not be alive, it's going to try and survive. And the only way it can survive is going from one host who is not immune, but the virus is infected, to another host who is not immune. And so as we see people my age, in a very high percentage here in Contra Costa County and in Alameda County, throughout the Bay Area, and throughout much of the United States, people my age are vaccinated. So where's the virus going to go to survive? Well, it's going to have to go to people who aren't vaccinated, because as Dr. Moody and Dr. Musin mentioned, the vaccines work wonderfully well, vaccines that we're privileged to have in this country. So it's going to go to people that are not vaccinated, and unfortunately, that's younger people. And so we're seeing, for example, mortality rates are now higher in people in their 30s and 40s and 50s than they are in people my age group. And when we look at pediatrics, since the vaccine is not available for children under the age of 12, you've got a large pool of people where the virus is going to go. So it just is a compelling argument from a population standpoint that we need to vaccinate these populations that are still susceptible. Otherwise, this virus is going to continue to find homes. And what was alluded to earlier, once the virus is replicating in another individual, that individual not only becomes a viral factory, but that individual becomes a factory for producing variants. And that's what we have to stop.
Yeah, thank you for that. It's really important understanding. And I think there is a sense that, it was our seniors who were getting the sickest and dying at the height of this pandemic, and not our children. And so, but to your point, because of the vaccine penetration in our older age groups, they become less vulnerable. So it's really important. So obviously, as we've talked about, safety is the biggest concern for families and for parents who are making this important decision. And so one of the questions that I know I hear is, how do we know that this vaccine is safe for kids, right? I know some people are worried about the trial period was too rushed. So can you address that, Professor Schwartzberg? What do you think of, the trials for the vaccines and the younger age groups?
Well, the trials for the trials for the vaccines in general were not rushed. They went through every stage, phases 1, 2, and 3, that all vaccines have gone through, and these vaccines went through in a very, very rigorous fashion. We were ironically fortunate to be doing these trials at a time when we could get results very quickly, because recall that we started those trials a year ago and continued through last fall and winter when COVID was rampant. So very quickly, we could see who was getting infected in the control group versus the trial group. and we got results very quickly. To the point of these studies being done quickly, where did we look at them long enough before we would see complications? We looked at them plenty long. You know, when you look at the history of vaccination now, that goes back, well, back into the late 17th century with smallpox, but more importantly in the modern era, if you will, in the 19th century. So for 120 years of vaccines, when you study these vaccines and you give them to people, almost all the serious complications that are going to occur in a large group of people or in a significant group of people are going to occur within the first 6 to 8 weeks. And so these vaccines didn't even get an emergency use authorization until well past 8 weeks of trial. So we knew that we weren't going to see anything, oh my God, there's all these people coming down with problems from these vaccines once we started giving them. On the other hand, when you start giving anything, an aspirin tablet or a vaccine to millions and millions of people, and ultimately we're talking about the COVID vaccine to billions of people, you're going to see very rare things. So if the question is, are these vaccines 100% safe? No. There's nothing in life that's 100% safe. Do these vaccines sort of approximate being 100% safe? Yeah. You're talking about serious complications, like, for example, with the advisory committee to the CDC is started meeting today on myocarditis, the inflammation of the heart, whether or not the vaccine's associated with that. These are very rare events. 1 case, 2 cases, maybe 3 out of 100,000. So we will see these things happen. So when people are making the decision about a vaccination, yes, they are quite safe, but they're not 100% safe, but they're far and away less risky than getting COVID and the consequences of that, even in very young children, as Dr. Moody and Dr. Mason pointed out.
Thank you for that. And one of the questions we got from Carol is, do we know where we are in the process of having authorization for kids under 12? And that'll happen.
I think we're getting there. The next group is going to be the ages 6 through 12. And I think there's a good chance that we'll have an EUA sometime in the early fall.
Okay. Well, that's my kids' age group, so I look forward to that.
It's my granddaughters. We're looking forward to that too.
Well, thank you, Professor Schwartzberg. And as I mentioned when we opened, we're so lucky to have a youth advocate for us today who understands this firsthand. So, you know, Katie mentioned to me when we started that she loves talking all things public health. And so, you know, she works to discuss the safety and impact of the vaccine on youth population. And so I invited Katie here to join us and to be an important voice for youth in this conversation. So Katie, welcome. Can you start by telling us a little bit about Generation Up and the work that you're doing as Director of Innovation and Strategy?
Of course, yeah. So as a brief overview, GenUp is an entirely youth-led education advocacy organization. We have roughly 4,000 members across California and the nation, and our goal really is to uplift student voices into the conversations that really impact our education. And in doing so, we also hope to mobilize our members to fight for a more equitable education system for all students. As for my role specifically as the Director of Innovation and Strategy, I really work on identifying and developing areas of opportunity and growth within the organization. So especially on the advocacy front with regards to new campaigns, new initiatives. A lot of my work this past year, as I'm sure is true for many community-based organizations, has revolved around the pandemic, and more specifically for an education-related organization that would be on distance learning and now school reopenings and youth vaccinations. So as we've seen, distance learning has not only exacerbated a lot of existing inequalities like the achievement gap, but also created new ones like the mental health crisis, a lack of access to basic resources. So GenUp has created a lot of campaigns just during the pandemic to really mitigate the impact of online learning, but we do acknowledge that really school reopening, once it is safe and effective to do so, is one of the most important aspects of creating a more equitable education system. And so because vaccines have recently become available to school age populations, we've been super active on this front lately. We've gotten involved in a lot more health advocacy. So actually, Senator Richard Pan's office recently reached out to us about the potential partnership to really use our member base to push for an increase in youth vaccinations. And well, when we had the chance to sort of fight for the reopening of schools and districts in time for the 2021 to 2022 school year, we couldn't give this chance up. So as a result, we've been working with their office as well as the organizations Protect Us, which is an adult-run public health organization that really focuses on getting rid of misinformation about various public health measures like masks, like the vaccine, as well as various youth-run organizations like Teens for Vaccine, which actually run on social media sites like Instagram and Reddit that youth really frequently use to sort of give the correct information about vaccines. So we've been in an incredibly productive partnership. They're super great organizations to work with, and we've really found that our work intersects really on the area of uplifting student perspectives, questions, opinions about the vaccine, and making sure that they're addressed by the professionals who actually do know the answer to them.
I love that. And I think it's so important, we know how to communicate best with our peers, right? That's true for all of us. And so your voices are obviously so important at this moment. I know that I've spoken to many friends who have kids that are eligible for the vaccine, and the kids themselves have concerns, and we should be addressing those too. And I think you're a powerful voice in that. So thank you. But what have you been hearing? What kind of question have you been hearing? Questions and concerns from your peers about vaccinations, and how are you responding?
Yeah, definitely. This is actually a pretty great place to talk about an event that we recently held with the other organizations I mentioned. So just a discussion-based town hall where we invited a bunch of students across California to share their thoughts, their questions, their doubts about the vaccine. And just one of the main questions we received during the town hall actually revolved around the topic of misinformation and what they as student advocates could really do to really convince their peers who were hesitant about the vaccine due to misinformation to go get vaccinated. So what we found was that a lot of school districts and teachers as well weren't doing a really great job of providing information to students, and especially for younger populations. What this does for them is that they sort of have to rely on finding their information from outside sources, which oftentimes don't contain credible information, and sometimes they deliberately seek to misinform their audiences. So misinformation has really grown up there along with the political divide as an obstacle to ensuring that students are getting vaccinated. So we've really been encouraging students who have gotten vaccinated, who do have credible resources about the vaccine, to share these resources, but also to share their stories about the vaccine, just to give their peers this push of encouragement, of familiarity. We found that really peer-to-peer stories are often very, very effective at ensuring students who are on the fence about getting the vaccine go get their vaccinated. But even more so, our three organizations have been launching a recent campaign which among many other asks have tried to ask districts to provide more information, to take responsibility for ensuring that their students are able to make really informed decisions about the vaccine. I would say that another question that came up a lot was actually about the sort of discrepancy between parents' wishes and student wishes to get the vaccine. Found that the parents were sometimes hesitant to let their child get vaccinated, while the student themselves was eager to do so. And just because the vaccine actually requires parental consent, when students are the ones getting it, we do sort of see this has become a barrier to many students who do wish to get vaccinated. So a lot of our panelists today have actually addressed this issue, but I guess my advice as a student is to really have honest and open conversations with your parents, really take the time to ask them the source of their hesitancy, and without harshly reacting or judging them, I think have a conversation in which you pull resources from credible sites that you and your parents both trust. This could be a county-based COVID COVID-19 website. This could be your local university resources page. This could be the CDC or a similarly credible organization. And really also share about why you want to get vaccinated, whether that is because you want to protect your loved ones, whether that's because you want to see your friends again, to be able to return to school in the fall without really worrying about the risk of COVID for yourself and those around you. So really sharing that with your parents, just because parents care about your safety. That is one of the main reasons why they're hesitant to allow students to get vaccine, but really sharing your reasons for why might be able to convince them. As an advocacy organization, it's a bit hard for us to really go out and convince parents to let students get vaccinated, but we've been trying to encourage districts to really have conversations with students and parents alike and really help them collectively to make the informed decision about the vaccine. One more thing that came up was actually the topic of vaccine accessibility. But the good thing is that over the past few weeks, a lot of school districts have actually begun transforming their school sites into pop-up vaccine clinics. So San Diego Unified, Fresno Unified, my own district, San Jose Unified, and just various districts across the state of California have really been making an effort to ensure accessibility is a factor for getting vaccinated. So I really encourage you, if this accessibility has been a main issue for you or your peers in getting the vaccine, to reach out to your school administrators, to your teachers, and see if this is something your school has been doing. We at GenUp have recently begun the campaign, which I mentioned earlier, and part of that campaign is to have our local chapters work with community-based health centers to hold pop-up vaccine clinics on school sites, just so that it's accessible to all.
Okay, well, Katie, your generation is definitely going to save the world. You are incredible. And I think, I will speak for our pediatricians, they can correct me if I'm wrong, but I know that the youth healthcare providers, I'm sure, would be happy to talk to any parent about the safety, and they're both nodding their heads. So I think it's safe to say, the youth should also reach out to tell their parent to talk to their pediatrician. I know my son already knows how to email his pediatrician when he has questions that he doesn't want me to ask. So, that's always a great source as well. But, I'm just so grateful for this peer-to-peer education you guys are doing, because there really is nothing like it. I think you're absolutely right. And it's such a powerful thing. And misinformation for those that are on social media is so rampant. And so, teaching, it's one of the things I really hope, social media wasn't around when I was in school. So now I'm aging myself. But so we didn't learn, nobody taught us the skills that needed to be understood to separate out, the misinformation from the real information, because it wasn't around. But now it's really something I hope that future generations are learning, because there is so much misinformation, and what we need to be making these important decisions based on good scientific information, which is why we hold these town halls, because we want to be a source of good information. But thank you, Katie. So if our youth that are watching want to get involved in this incredible effort of yours to help have peer-to-peer engagement on this issue, how do they get involved?
Yeah, so it's a pretty huge coincidence that just this morning, 3 organizations I mentioned, so GenUp, Protect Us, and Teens for Vaccine, have launched our campaign to search for youth organizers to help us in this campaign to increase youth vaccination. So I'm actually gonna put the link to a Google form in the chat, but you can also find it at tinyurl.com/public health organizing. It's right here. Basically, as a youth organizer, you could do anything from helping us write public health legislation, to helping set up these pop-up vaccine clinics, to helping us organize informational assemblies within your district for students and parents. So I've sent it in chat. I hope you can see it and go ahead and fill it out if you're interested. But I also just really want to emphasize that there is you do not have to be involved in any sort of formal role in order to just be an advocate for yourself and for your peers. I think very small actions, from just resharing credible social media posts about the vaccine to encouraging your friends who aren't vaccinated to go get the vaccine, those are possibly some of the most important actions that as a students can take in advocating for their own health and the health of their community members, their friends, their family.
Thank you, Katie. I hope more people will take your advice and do that. It's awesome, the work you're doing. So now nobody on this the Zoom will be surprised that we have a lot of questions. So let's get to the audience's question. The first one, which we've gotten from quite a few participants, so we're going to ask it first, is that some participants have expressed concerns about vaccinating children because the World Health Organization has recommended not to use the vaccine on people under the age of 19. So can the panelists talk about that and the varying guidance of government entities and agencies such as the CDC, the WHO, and the FDA? Should we start with Dr. Moody? Do you want to take that first?
Sure. So I happened to look at the WHO site this morning. And if you go on and look at what they state around vaccinating under 18, they say that it is reasonable to use the vaccine on 12 and up, especially the Pfizer, based on the data they have. So I want to be clear, the WHO has not come out and said, do not vaccinate below 19. They said that it is permissible to and reasonable to use the vaccine. They do state that they think ongoing studies should be done, and that is true of everything. And if you talk to any pediatrician, any public health professional, they'll say, yes, we study these. This vaccine is going to be one of the most, I think, well-studied interventions ever done, just based on the amount of data that's come out already. In fact, the CDC made a wonderful tool to go along with this vaccine campaign called VSafe. And I encourage everyone who gets vaccinated to enroll in VSafe because it collects safety data actively. They text you, check in with you. It's a great way to collect information on vaccine safety that kind of complements VAERS, the one that most people know of, which is the vaccine adverse effect reporting system. But the WHO has not said don't vaccinate under 19. So that's a bit of misinformation.
Okay, thank you. Professor Schwartzberg, anything to add on that?
No, I think Dr. Moody said it perfectly. I would emphasize VSafe. They're supposed to tell you about enrolling in VSafe when you get vaccinated, but that often doesn't happen. So be sure to do that. It's really easy to do if you have a smartphone, and it's a way to collect just incredibly valuable information.
Okay, thank you. And I guess follow up on that, which I'll ask is, so I know a lot is made of the fact that the authorization right now is only emergency authorization, right? Professor, can you talk a little bit about the difference between that and the full-blown authorization and what that tells us about studies and the efficacy?
Sure. The emergency use authorization, EUA, was designed a long time ago for exactly this kind of purpose. That is, we couldn't wait to go through the entire process, which would take just much too long to have full authorization, FDA approval. And so that's where the EUA came in. The EUA, as I mentioned earlier, was not issued until we had very confident data that these vaccines were both safe and effective. So right now we're waiting for full FDA approval of the vaccines. And I think the Pfizer vaccine will probably be the first one. My fingers are crossed that it's going to be before the school year starts this fall, because I think that that's going to really accelerate the people who will be willing to get vaccinated. These are governmental structures, the EUA and the approval structure, the FDA approval structure, that are set up to organize how the vaccines will be utilized. And so to get to FDA full approval, you have to have a certain interval of time after the vaccine has been used, studied. And that's what's dragging things out a little bit here. It's not really dragging them out, this is the time it takes to get that full FDA approval. So from our participants' perspective, the EUA was issued at a time when we were confident this was a safe and effective vaccine. The fact that we don't have full FDA approval does not say anything about these vaccines not being safe. I will think it, but I do think we will get more people vaccinated once we have that FDA seal of approval, if you will.
Awesome, thank you. Okay, Dr. Mazan, I'm gonna give this one to you. So here's a question from an anonymous participant. Are teens, and specifically 13-year-olds, allowed to take the second dose since we were told to hold off due to CDC findings?
I think that is misinformation. They can get both doses A-okay. I haven't I'm not even sure where that misinformation comes from, but no, I've not heard anything like that. Please go get your second dose. Your dose, as we all, know the Pfizer dose is 21 days. Sometimes I think when summers happen, being some questions around like, oh, that's when we have a vacation. It may be a little bit later, and that's fine. Like, please just go ahead and get your first dose. If your second dose happens to be at 4 weeks or 5 weeks because of a trip or a camp, go ahead. That is an A-OK thing to do. Just get your dose, keep your card. And you can even get, if your first dose at one location and you happen, to want to go to a different location to get your second dose, also fine, just bring your card, get both things done. And then as a pediatrician, also just bring it to our office. We'll make sure we get it into your vaccine record so you have it, give backup at our office, just in case you lose the card, we'll have it too.
Nice. And I will say one part about that, which is the state system is challenging to get a card replaced if it's lost. The county has stepped in to fill that void. So you can also reach out if you lost your card to county health, and they can help you as well. So one thing I do know on this is how to get cards replaced. So here's one. The vaccines do not prevent infection. And you can tell me if that's true or false. How does that impact the community spread? Are seniors not getting infected, but passing the virus on to kids?
It does prevent infection. You can test positive for COVID even after getting vaccinated. That is true. The rate of your ability to transmit to somebody else is less, and these cases are like really rare, and they track them. And Dr. Moody may be able to have more information about this than me, but no, it does prevent infection. It does prevent transmission, and it. We had a third question. It was whether
well, you've basically answered it, because it was whether seniors can then get infected when they've been transmitted to kids.
One of the things that I think Dr. Moody brought up before, Dr. Schwartzberg also talked about, that is so important, is that there are populations that either can't get vaccinated or perhaps are immune compromised, so they can get vaccinated, but maybe in those cases for them it isn't quite as efficacious. And it sort of goes back to that very first thing. This is why we want to vaccinate everybody, including this age group, this 12 to 15 or 12 to 18 group, because this is how we help those in our community who maybe because of a health condition didn't have as quite a good of a vaccine uptake for themselves. So I think that's just sort of back to our first point of why it's important to do that. But no, I think no impediment there at all.
Okay, anything to add, Dr. Moody?
Yeah, I would say that the vaccine does prevent infection to a certain degree. No vaccine has been created yet that's 100% effective at preventing infection. I want to shake the hands of the scientist who does that one day. But there's no 100% certainty of anything. But this vaccine is very good at preventing infection, up to the 80–90% that we're seeing in studies coming out of real world use. Nearly 3 billion doses, 3 billion have been given worldwide so far of the COVID vaccine. The majority of those are the mRNA vaccines, which is what we're talking about for kids, the Pfizer. So with the studies that are coming out, I think we're going to see it's good at preventing infection. It won't prevent infection in everyone, but those who do end up getting infected with COVID will either be asymptomatic, have very mild, or if they were immunocompromised, something else happens, there's a possibility of more severe, but nothing's 100% certain. But this is by far the best tool we have, by far the best tool we have to prevent illness, death, all of the terrible things associated with COVID.
Yeah, thank you. So here's a question from Vaishali. She wants to know what advice you would give for children who have a reaction after the first shot, such as dizziness, weakness, or blackouts. Should that child get the second shot? Like Dr. Meeson?
They should absolutely get second shot. A lot of kids feel with, this is sort of the age group when, that's where they have you wait the 15 minutes. A lot of kids get lightheaded after vaccines or with blood draws or anything that, seeing blood, all those things for people can cause those sort of symptoms. And And I do think it's important to wait that 15 minutes, go in hydrated. If you know that your child tends to be someone who might faint or feel lightheaded, have breakfast that morning, don't skip, make sure that they had an athletic practice that morning, that they've eaten a snack. And then just wait there. If you know that, or even wait a little extra time, wait the 30 minutes and, bring a book with you to the vaccine site, that's fine, and just have a little rest versus trying to leap up and maybe go off and run an errand or something. But kids are, they have low blood pressure, they're super healthy, they often will feel more faint or lightheaded after they are vaccinated. But we're ready for that, and that's something that we can accommodate. After vaccine, people feel symptoms often too. They might have a fever or headache or feel body aches, and that's your awesome body doing all this amazing stuff to make all those cells to remember this virus for later. So this is, I always find it super reassuring. Good for your kid. Their body's super smart and is doing all the right things to prepare itself if it ever saw the virus in real life. So I find those symptoms, if anything, reassuring.
Thank you. Katie, do you have anything to add on this? What are you saying about, how they feel after the vaccine and sharing that information with other youth?
Yeah, I actually have a personal anecdote about this. I have a brother, he's 14 years old, and after his first shot, he did say that he felt kind of out of breath. I guess we were concerned at first, of course, that we don't want my brother to have any super significant symptoms if he does get the second shot, but our pediatrician recommended that we do. So, my brother went and got a second shot, came home, slept for about 6 hours from 12 to 6 p.m. and he was perfectly fine after that. So a lot of the time, I just really want to re-emphasize what Dr. Meason has said. Younger students are going to have more severe effects, but that does not mean that the vaccine is dangerous. It just means that the vaccine is working as it should, and that definitely don't let that stop you from getting the vaccine.
Thank you. Yeah, I know my kids, I had a I didn't feel so great after I got mine, I'm going to be honest. And my kids saw that, but I told them it means that I'm safe because my body already reacted to the virus. So I know that might make them a little nervous having seen me with my fever, but I'm in great shape. 24 hours later, I was just fine. So that's the goal. Lacey asks, how concerned should parents of younger children be? So I'm assuming this is the under 12 set, so the non-eligible children, be with the rise of the Delta variant if the vaccine is postponed for that age group. Dr. Moody, you want to take that?
Sure. So I think a reasonable amount of caution in terms of trying to hold play dates outside, if you're indoors masking, if you're mixing with other households, just continuing to practice some of those common sense infection control things that we've been doing all along. Hand washing, avoid touching the face. The ACIP, the CDC is going to review the data as it comes in and hopefully approve it for those age groups in the fall, as Professor Schwartzberg said. But in the meantime, because it's summer, lots of playing outside, the things kids like to do, and just try to follow those things that we've all been doing all along.
Thank you. Dr. Meason, anything to add?
No, I think we're really good at this now, and I would just continue up our best practices. We happen to live in just a beautiful part of the country where people can be outside, you can play outside. I think it's extraordinarily important for children to play together and to be together outside, to do activities, whether it's sports or play dates or whatever. Go to playgrounds, go swimming. These are really all safe things to do. As Dr. Moody mentioned, like if you're indoors mixing groups, then of course, put the mask on. Kids are great at that. They're better than adults sometimes at getting their mask right and doing it. So, but I would really want to encourage parents to live a full life right now. We have so much information about what's best to do. Please go out and do it. Do the things that bring you joy. This is a time for us to appreciate the fact that, as Dr. Moody mentioned in the beginning, our rates of vaccine take up actually are really good. Over 50%, and they're rising. So as more and more of the community 12 and up gets vaccinated, it really creates this safety net in that children can participate in the world more fully.
I love that. And I know I want to turn this to Katie for a second, because one of the things I think Dr. Mizan just touched on was really protecting our kids' mental health too, right? I think that's so critical. I mean, their physical health is paramount, but we know that when we asked them to stay home, it had a real impact on their mental health. And so, you know, I think that being able to balance those two is really critical. And we do live in one of the most beautiful places. I'm biased, I know, but you know, our kids can do outdoor activities and they enjoy it. And even on hot days, throw them in the shade and put a hose on them for just a minute because we are in a drought. But you know, there are good things to do. So Katie, anything to add on that?
I mean, not really, but just that I guess online learning, sort of having to communicate with friends solely through online means has really been a bummer for a lot of students. So having the chance to mask up, especially once you're vaccinated, you hang out with friends, that's definitely a reason to go get vaccinated, just to ensure that you can really enjoy spending time with people you care about again, and I guess in a setting in which you can properly interact with one another.
Thank you. I appreciate that. And it's true. Kids are so good at masking. They really don't mind. I also think it's been long enough in their life that they are a little bit used to it. But yeah, I know that speaking from my own experience, it's never been a fight with my children to ask them to wear a mask, and they see us modeling it. So it's important. So here's a question for you, Professor Schwartzberg. Saros asks, why are human trials not being done with the vaccines against the new variants to demonstrate effectiveness to prevent transmission of the variants?
Well, they are being done against the new variants. Unfortunately, there are a lot of variants that we can test it against. And the trials that are ongoing are to a large extent challenging these vaccines with the variants that we're all very much aware of right now. So I think what the questioner may be asking is the original trials, which were done with the mRNA vaccines, Moderna and Pfizer, were done last summer when there were no significant variants circulating. The J&J vaccine was done to a large part in the winter when there were some variants circulating, so we have some data on that. But you know, we've continued. It's not like the trials with the mRNA vaccines have stopped. They're continuing. So we're seeing, not only here in the United States, but we're seeing how well they perform against these variants throughout the world. Coming back to the question about the Delta variant, which is on everybody's mind right now, we have really good data against how well the mRNA vaccines do against that variant, and they do quite well. So I think the people who are fully vaccinated, not partially, they don't do well at all if you're partially vaccinated, but if you're fully vaccinated, the Delta variant is not going to represent a significant problem to you. So it's just another argument for getting everybody vaccinated that can get vaccinated. And as Dr. Mizan was saying, the way to protect your children if they can't get vaccinated, if they're under the age of 12, is to get everybody around them vaccinated. So that becomes the critical strategy. And it will protect us against this Delta variant, which I think is on track to become the dominant strain here in the United States within a relatively short period of time.
Thank you. I think we have one more, but this one I want to ask, because this is actually something I've heard people say in my own community. And so I do want you to address it. And the question is, here's the question from the person who wrote in, I've heard that spike proteins have been found in higher prevalence in ovaries. So the question is whether or not this could affect future fertility for girls who receive the vaccine. And this is something I've heard moms of girls say to me. And so I think it's important that we address it. Is there any reason to believe that giving this vaccine to young girls could affect future fertility?
Sure. There's no biological plausibility for that. And there's actually no scientific evidence for that. And we actually have been studying that rigorously. So I think, the pithy answer is that there is nothing to suggest that it's going to affect fertility problems in young people. For that matter, it's not going to affect fertility problems in anybody. So I think that this is a good example of what Katie was talking about earlier in regards to misinformation on the internet. and needs to be corrected. And by the way, if there's any way that I can recruit Katie to come to UC Berkeley School of Public Health, I'd really like to do that.
I think that she might be open to that, but I don't want to speak for her.
Or medical school. I mean, being a physician is a great way to individually work on public health. You can be like Dr. Moody and do both things. I mean, I just, my career might like you too. You can
be anything you want to be, Katie. We're all very, very excited for your future. But I do think, even now, I think she should be teaching some of our public health experts really what it means to have youth speaking to youth. It's such a critical piece of this effort. So thank you. I know we didn't get to all the questions today, and I know there were more questions about safety and efficacy, and this was really just an opportunity to get our experts together and try to answer some questions. But I do want to close by saying that these resources are there for you, and I want you to know that your health provider wants you to ask them these questions. They want you to feel safe. They want you to join the effort in getting vaccinated, but only after getting your questions answered. So if you had a question that didn't get answered, please reach out to your healthcare provider, whether it be one of our private providers, our public health providers, or, to be honest, county health, right? Our county health providers are really our partners in this, and they can help answer questions as well. So don't hesitate to ask these questions, to get them answered, and then hopefully you'll find that it's a safe process and that getting these vaccines are safer than getting COVID. So thank you for being here. Being here means you are engaging and you want to get the information for you and your family, and that's really critical. So Generation Up is here to provide information, as are our incredible healthcare providers, Access, John Muir, Sutter, and Kaiser as well. So please reach out, get the information you need, and then we look forward to getting this community to a place where we truly have herd immunity, and we can even tell our young ones that they don't have to wear masks inside. But one question we did get was, should my 7-year-old still be wearing a mask? And I think I heard Dr. Moody and Dr. Muzan saying that, our current government guidance is that if you are unvaccinated, masking is still a critical part of helping stop the spread. And so your 7-year-old, I'm guessing, is unvaccinated because they're not eligible. So we do need to continue to follow the guidance that is out there, to continue to mask for those that are unvaccinated, including our youngest children, and following all of the guidance that continues to be put out. But luckily, we've gotten ourselves, thanks to these incredible vaccines, to a place where we can live a full life, as Dr. Muzan said. So thank you all for being our partners in that, to getting us where we are today and being engaged in our community. So be in touch if you have any questions, and stay safe and be healthy. And if I didn't thank you guys all for being here. You were incredible. We've spent, and I know our participants might still be here, and I know they're thinking the same thing. So thank you guys.
Thank you for having us.
Of course.